We're going to be discussing Chapter 2 of your textbook, and it deals with physical and mental health and healthcare. The learning objectives are as follows. They are to compare life expectancy and mortality in low, middle, and high-income countries and identify ways in which globalization affects health and healthcare, to describe the prevalence, impact, and causes of mental illness, to explain how conflict theory, structural functionalism, and symbolic interactionism helps us understand illness and healthcare, to identify 5 lifestyle behaviors that influence health and give examples of how socioeconomic status, gender, race, and ethnicity affect health, to identify and describe the various types of private insurance plans and public healthcare insurance programs in the United States and differentiate between allopathic medicine and complementary and alternative medicine, to critically evaluate healthcare in the United States on the dimensions of health insurance coverage, cost of healthcare, and adequacy of mental health care, and finally to discuss the complexity of factors that affect health and that they must be addressed in order to improve the health of society. So this is the chapter outline and the outline for the PowerPoint. I won't go over it, but it's just the outline of what we're going to be discussing. So first, the global context, health and illness around the world. So countries are often classified into one of 3 broad categories according to their economic status. Developed countries have relatively high gross national income and have economies made up of many different industries. Developing countries, which are less developed than developed countries, have relatively low gross national income and their economies are much simpler. And finally, least developed countries are the poorest countries of the world. We used to refer to these countries as like first world. I'm sure you've heard of third world, but we've moved on from identifying them in such a way, and now we call them developed countries, developing countries, and least developed countries. So life expectancy and mortality. Life expectancy refers to the average number of years individuals born in a given year can expect to live. Each country has their own life expectancy. So for example, here in the United States, the average age that somebody will live is 78 years old. Mortality. Mortality is the incidence of death in a population. The leading cause of mortality or death worldwide is heart disease, followed by stroke and respiratory infections. In low-income countries, the 3 top causes of death are respiratory infections, diarrheal diseases, and HIV and AIDS. So mortality basically means death. So mortality among infants and children. Infant mortality rate is the number of deaths of live-born infants under 1 year of age per 1,000 live births in any given year. The under 5 mortality rate refers to the rate of death of children under the age of 5. Under 5 mortality rates range from an average of 5 in high-income nations to an average of 53 in low-income nations. And onto maternal mortality rates. It's a measure of deaths that result from complications associated with pregnancy and children. The most common causes of maternal death are hemorrhage, infection, high blood pressure during pregnancy, and unsafe abortions. So really quick, just to think for yourself, not that you have to answer this or turn it in for any work, but just to think about what we're talking about. Suppose that you and your partner had a 1 in 40 chance of dying from a pregnancy or childbirth related cause, the same risk of maternal death that women in low-income countries face. Would that knowledge affect your views about 1, having children, 2, using contraception, and 3, policies to ensure access to safe abortion? So this is just basically asking you if you were in the same position as someone living in a low-income country where you had a 1 in 40 chance of dying during pregnancy, would your views change on having children, on using contraceptive and having safe sex, and would your views change on abortion as well? Think about that to yourself. Like I said, it's not something that we're going to talk about, just to give you an idea so you can start thinking about our chapter. So globalization, health, and medical care. Globalization is the growing economic, political, and social interconnectedness among societies throughout the world. It has eroded boundaries that separate societies, creating a global village. Global communications make it easier to monitor and control disease and share scientific knowledge and research findings. And increased travel and the expansion of trade and transitional corporations are linked to a number of health problems. So look exactly what's going on with the coronavirus and how it's a global pandemic. Globalization and global communications is making it easier on us to figure out what is going on right now. So that's just an idea of what globalization is. Medical tourism is a growing multi-billion-dollar global industry that involves traveling primarily across international borders for the purpose of obtaining medical care. Some risks that you may incur if you were to partake in medical tourism is unregulated care. It may spread infectious diseases, and it may encourage black market organ sales. So there's a whole topic of concerning medical tourism. Is it ethical? Is it unethical? Um, and a question that you have to ask yourself when you think about ethics of medical tourism: do you think it's ethical to go to some country and be able to, let's say, buy someone's organ, someone who's living in poverty that may want to sell you his kidney for a few $1,000s so that they can survive in their country, which happens a lot, which is what the black market is talking about here, the black market in organ sales. Um, I know that many people will be like, well, if it's cheaper to go to another country to get a service, why not go? If it's cheaper to get medication at another country, why not go? And I understand how anybody would want to save money if they possibly can, especially since um, the vast majority of Americans, when it talks about credit, many are in have medical debt. So I mean, I could see why people would partake in medical tourism, but you have to understand as well that there are ethical issues surrounding medical tourism. So here is an example. Many Americans cross the border into Mexico to obtain less expensive dental care. And you may say to yourself, well, yeah, if you're going to save money, why not? You're just going to the dentist. And I can see why people may agree with that. But like I said, there's a broader conversation to be had about how many times we see in medical tourism how people who may have money are kind of taking advantage of people living in poverty by buying organs and such. So mental health. Mental health refers to the successful performance of mental function, resulting in productive activities, fulfilling relationships with other people, and the ability to adapt to change and cope with adversity. Mental illness refers to collectively to all mental disorders which are characterized by sustained patterns of abnormal thinking, mood, or behaviors that are accompanied by significant distress and or impairment in daily functioning. It is a hidden epidemic because the shame and embarrassment associated with mental problems discourage people from acknowledging and talking about them. So, among the non-institutionalized population, as many as 1 in 5 U.S. adults experience mental illness. 1 in 20 had a serious mental illness. And people within the ages of 4 and 17, 10% experience a major depressive episode. And about half of all Americans will experience some form of mental disorder in their lifetime, with first onset usually occurring in childhood or adolescence. So, untreated mental disorders can lead to poor educational achievement, lost productivity, unsuccessful relationships, significant distress, violence and abuse, incarceration, and poverty. There is conversations, discourse that talks about how many of the population that is incarcerated have a mental disorder or mental illness or some sort of mental issue, and how we are incarcerating um, uh, people that need not be incarcerated, that they should be seeking treatment. The fact that this is happening is basically because a lot of institutions that dealt with mental illness or people suffering from mental illness have been closed. So now, for the most part, a lot of people suffering from mental illness are incarcerated. So, stigma surrounding mental illness is partly due to misconceptions about their causes, such as misconception that mental illness is caused by personal weakness or result from engaging in immoral behavior. So, mental illness among college students. 1 in 4 college students has been diagnosed or treated by a professional for a mental health problem within the past year. 16% of college students were diagnosed or treated for anxiety, 13% were treated for depression, and 7% were treated for panic attacks. So here is a graph: mental illness, the hidden epidemic, mental health difficulty. So here's felt depressed, it was difficult to function, felt overwhelmed, and anxiety, felt very lonely, felt things were hopeless, seriously considered suicide, intentionally cut, burned, bruised, or otherwise hurt themselves. So this is adapted from the American College of Health Association, and it is a summary from 2015. And this is what they asked college students, and 35% felt depressed, that it was difficult to function. 57% had some sort of overwhelming anxiety. 59% felt feelings of loneliness. 49% had feelings of hopelessness. 9% seriously considered suicide, and 6% had either intentionally cut, burned, bruised, or otherwise hurt themselves. So, sociological theories of illness and healthcare. Structural functionalist perspective. So, according to the structural functionalist perspective, healthcare is a social institution that functions to maintain the well-being of social members and consequently of the social system as a whole. It examines how changes in society affect health, and it also draws attention to the latent dysfunctions or unintended and often unrecognized negative consequences of social patterns or behaviors. The conflict perspective focuses on how wealth, status, and power influence illness and healthcare. It points to ways in which powerful groups and wealthy corporations influence health-related policies and laws through lobbying and financial contributions to politicians and political candidates. And it criticizes the pharmaceutical and healthcare industry for placing profits over people. So a conflict theorist may point out how the pharmaceutical company works with the government and how they work hand in hand in creating guidelines or laws, and how by lobbying the government, the pharmaceutical company is basically placing profits over people. So in a perfect world, medications would be cheap and people would be able to afford them, but we don't live in that world. Usually medications are extremely high. For example, the EpiPen, I know that is expensive, and there's so many kids nowadays that are allergic to peanuts, and they all need to have at least 3 EpiPens, one for at school, one for home, and one you're able to take out. So you know it's this cost that people ask, why are pharmaceutical companies making so much money? When at the end of the day we should be worried about people and not profit. And then the symbolic interactionist perspective focuses on how meanings, definitions, and labels influence health, illness, and healthcare, and how such meanings are learned through interaction with others and through media messages and portrayals. So, medicalization is defining or labeling behaviors and conditions as medical problems. This is the symbolic interactionist would look at medicalization and how it's a new phenomenon defined as a medical problem in need of medical intervention, such as post-traumatic stress disorder and attention deficient hyperactivity disorder, which is ADHD, and normal conditions that are defined as medical problems such as childbirth, menopause, and death. So this is just basically that we've medicalized behavior. Like childbirth is a medical condition, menopause is a medical condition, death is a medical condition or a medical problem. So the fact that these are just things that happen throughout life, and they're absolutely normal, a symbolic interactionist will look at why we medicalize stuff like that. Symbolic interactionists also focus on the stigmatization of individuals who are in poor health or who lack healthcare insurance. A stigma refers to any personal characteristic associated with social disgrace, rejection, or discrediting. Symbolic interactionists focus on stigmatizing effects of being labeled ill. Individuals with mental illness, drug addictions, physical deformities and impairments, and HIV and AIDS are prone to be stigmatized. So, social factors and lifestyle behaviors, socioeconomic status, and health. So, before we go on to here, let's go really quick to your textbook and look at that. So, social factors and lifestyle behaviors associated with health and illness. Health problems are linked to lifestyle behaviors such as excessive alcohol consumption and cigarette smoking, unprotected sexual intercourse, physical inactivity, and an unhealthy diet. For example, most college students do not eat the recommended 5 or more servings of fruits and vegetables daily or exercise regularly. Their lifestyle behaviors partly explain why more than 1/3 of college students are overweight or obese. Obesity and other health problems are affected not only by lifestyle behaviors, but also by social factors such as socioeconomic status, race and ethnicity, and gender. So I wanted to point this out because this section is about social factors and lifestyle behaviors. The lifestyle behaviors are your behavior, your excessive alcohol consumption, the fact that you smoke cigarettes, if you're having unprotected sex, if you're not working out, if you're not eating healthy, those are all lifestyle behaviors. But the social factors associated with illness and health are socioeconomic status, race, ethnicity, and gender. So make sure that you're going to be able to differentiate between the two. Okay, they're not one and the same. You see here, let's go to the PowerPoint. So we went there, we did that, we did that. So, socioeconomic status refers to a person's position in society based on that person's level of educational attainment, occupation, and household income. Poverty is associated with malnutrition, indoor air pollution, hazardous working conditions, lack of access to medical care, and unsafe water and sanitation. Make sure that you know the definition of socioeconomic status because you will be asked that throughout the summer on quizzes, on tests, on the midterm, and on the final. So you need to know the definition of socioeconomic status. So individuals with low levels of education are more likely to engage in health risk behaviors. Women with less education are less likely to seek prenatal care and are more likely to smoke during pregnancy. In some cases, lack of education means that individuals do not know about health risks or how to avoid them. And socioeconomic status plays a part in this. On to gender. Gender discrimination and violence against women produce adverse health effects in girls and women worldwide. In many societies, women and girls are viewed and treated as socially inferior and are denied equal access to health care. Gender inequality also exposes women to sexual and domestic abuse. In the U.S., at least 1 in 3 women has been beaten, coerced into sex, or abused. In the United States today, the life expectancy of U.S. women is 81 years old. It is greater than that of U.S. men, which is 76. It's actually 78 now, like I said earlier, and it's still about 81 to 82 for women. The lower life expectancy in men is caused by several factors. They may have more dangerous work environment, and men engage in riskier behavior than women. So going back to this point right here, how gender inequality within the health system also exposes women to sexual and domestic abuse. Right now with the whole coronavirus pandemic, believe it or not, there's a lot of police calls of domestic abuse and women that are being beaten by their husbands. So not only is the actual beating and abuse a health issue, but the fact that we're under this bigger health concern and this bigger health issue, which is the pandemic, it is now causing people to live in lockdown, which is causing stress, which is causing domestic violence. So that's just showing you how health and how the health system and how all of this is interconnected in some shape or form. Race, when we speak about race and health, the U.S. racial and ethnic minorities are more likely than non-Hispanic whites to rate their health as fair or poor. Non-Hispanic black men and women have higher rates of heart disease and associated complications. The highest rates of obesity are among black Americans, followed by Hispanics. Health disparities among racial and ethnic minorities is largely due to differences in income, education, housing, and access to healthcare. Health disparities are sometimes explained by differences in lifestyle behaviors, like the lifestyle behaviors that we were speaking earlier, not working out, smoking cigarettes, drinking, whatever the case may be. Remember, those are lifestyle behaviors. Another factor could be the stress resulting from prejudice and discrimination. Finally, regarding mental health, research finds no significant difference among races in their overall rates of mental health. Let me go really quick to Blackboard to show you this, so you know you do have an assignment that's going to talk about the coronavirus and race. And this is basically what we're talking about, of the health disparities within race and ethnicities. You're going to read the article and watch the video. This is the link. And then you're going to answer the questions, whatever it is that it tells you to do here, and then submit it through this turnitinlink.com. Right here. So, U.S. healthcare and overview. In the United States, there is no one healthcare system. Rather, healthcare is offered through various private and public means. Most insurance companies control costs through managed care, which involves monitoring and controlling the decision of healthcare providers. So, Medicare. Medicare is funded by the federal government and reimburses the elderly and people with certain disabilities for their healthcare. So remember, Medicare deals with the elderly and certain people that have disabilities. Medicaid provides health care coverage for the poor. It's jointly funded by the federal and state governments. So there is a difference between the two. Medicare is elderly and people that have certain disabilities, and Medicaid is helping people that are living in poverty. Medicaid, which provides health coverage for the poor, is jointly funded again. So the state's Children Health Insurance Program provides health care coverage to children without insurance, many of whom come from families with income too high to qualify for Medicaid, but too low to afford private health insurance. So this is an insurance for children for families that can't get Medicaid, but also can't afford a private health insurance. In comparison of health care in 11 wealthy nations, the U.S. ranked last, despite the fact that health care spending, both per person and as a percentage of gross domestic product, is considerably higher in the U.S. than it is in other countries. So again, back to the coronavirus situation. Imagine we live in the United States. They spend the most money than any other country to deal with healthcare. And look what's going on now with the whole coronavirus and the pandemic. I know that this is something that we've never gone through before, but I don't know. We spend so much money for our health care. It's kind of surprising that we're the country with the most deaths of the coronavirus. So Medicare is funded by the federal government and reimburses the elderly and disabled for their health care. Medicare's medical insurance program is not free. Enrollees must pay a monthly premium as well as co-payments for services. Medicare does not cover long-term nursing home care, dental care, eyeglasses, or other types of services. Provides health coverage for the poor and is jointly funded. That's Medicaid. So Medicaid does not cover all poor people. Eligibility rules and benefits vary from state to state, and in many states, Medicaid provides health care only for the very poor who are well below the federal poverty level. And SHIP provides health care for children, like we stated before. So workman's compensation is also a type of health care insurance program that provides medical and living expenses for people with work-related injuries or illness. So if I got hurt at work or I got sick at work for some reason, I don't know, I'm working construction perfect example is after 9/11, the first responders um, uh, that got ill because of the response, many of them got workman's comp. Complementary and alternative medicine refers to a broad range of healthcare approaches, practices, and products that are not considered part of conventional, which is allopathic medicine. It includes herbal and homeopathic remedies, dietary supplements, meditation, Pilates, yoga, Tai Chi, acupuncture, chiropractor care, massage therapy, Reiki, and other energy work, and the use of traditional healers. Universal healthcare is a system of healthcare typically financed by the government that ensures healthcare coverage for all its citizens. In 2015, 9.1% of Americans, 33 million people, did not have healthcare insurance. Here in the United States, we don't really have a universal healthcare system like, let's say, Canada does. And honestly, things are changing so much with Trump right now. So I know as of right now, we do have what people commonly refer to as Obamacare, but for all we know, Obamacare may not exist within the next year. So this is something that's kind of changing right now, that we're living through this change. So yeah, I don't know where that is going to end up, but hopefully we could have something close to what Canada has, which is a universal healthcare system. That way everybody is covered and people don't have to die because they're poor. So health spending in the U.S. is far greater than any other industrialized country, like I said it earlier, yet nearly every other country has a better health outcome, as measured by life expectancy and infant mortality rate. So there's other countries the people are living longer, their infants aren't dying, they're spending less than we are spending, but for some reason we're not doing as good. And going back to the coronavirus example, we are the country with the most deaths, and we're spending the most money on healthcare. Again, that should bring up questions as to why that's going on. So I know I stated somewhere in the beginning of this recording that when we look at debt and the types of debt people have, this is a graph that shows the percentage of consumers contacted by debt collectors. And if we look, the number one is medical bills. 59% of the country is dealing with debt collectors for unpaid medical bills. That's not talking about the rest of the country and all their medical bills, and they're lucky enough to be able to pay them. But 59% of the country is receiving phone calls from debt collectors because of the money they owe in medical bills. You can compare it to other things here. Again, if we lived in a system with universal health care, we would not be dealing with this. We may be paying some higher taxes, but at the end of the day, what we would pay in taxes is definitely not going to be the amount of medical charges that we're going to incur if something were to happen to us. So several factors that have contributed to escalating medical costs. Increased longevity, meaning that people are living longer. Cost of hospital services and medical technology. Cost of prescription drugs. Cost of health insurance, and expensive medical technologies. So these are just factors as to why medical costs are raising. The fragmented system of mental health care leaves many people with mental health problems to fall through their cracks. Nearly 1/3 of the 10 million U.S. adults with serious mental illness in 2015 did not receive any mental health services in the past year. Mental health services are often inaccessible, especially in rural areas. So strategies for action in improving healthcare. So selective primary healthcare focuses on using specific interventions to target specific health problems, such as promoting condom use to prevent HIV infections. Comprehensive primary health care focuses on the broader social detriments of health, such as poverty and economic inequality, gender inequality, environment, and community development. So this would just focus on the whatever the ailment may be. This is a more sociological approach that focuses on the social factors such as poverty, economic inequality, gender inequality, environment, and community development. So improving health in low and middle income countries. Declines in maternal mortality can be attributed to several factors: deliveries by skilled healthcare workers, contraceptive use, family planning services, decline in child marriage, education and income, and immunization programs. So these are just basically strategies for low and middle income countries that they can probably use or they should use um, to deal with maternal mortality and its decline if they want to decline it, which of course, I mean, most countries, if not all, would want to decline maternal mortality. So HIV/AIDS prevention and alleviation strategies. Currently, there is no vaccine to prevent HIV infection. A number of other strategies are available to help prevent and treat HIV and AIDS. HIV and AIDS education and access to condoms, HIV testing and treatment, fighting against HIV/AIDS stigma and discrimination, needle exchange programs, and financial and medical aid in developing countries. On a side note, I used to teach HIV and AIDS prevention, and I used to do testing and counseling. So if any of you ever have any questions throughout the semester about HIV and AIDS and how you can protect yourself, or whatever questions that you may have, you could always email me. I did that for about 10 years, so I'm quite knowledgeable in it. So, fighting the growing problem of obesity. Another strategy. In general, reducing and preventing obesity requires encouraging people to eat a diet with sensible portions, with lots of high fiber fruits and vegetables, and with minimal sugar and fat. Some of the strategies include restrictions and advertisements, local and state anti obesity policies, workplace wellness programs, and public education and awareness. So one thing that you could think of that we did a strategy here in the U.S. was Michelle Obama decided to make it an initiative to change the school lunches for more healthier lunches in hopes to prevent obesity in children. So, strategies to improve mental health care. Two areas for improving mental health care in the United States are eliminating the stigma associated with mental illness and improving access to mental health programs. Eliminating the stigma and so yeah, I don't know why this basically said it twice. So in March 2010, the Patient Protection and Affordable Care Act, commonly referred to as the Affordable Care Act or Obamacare, like I had mentioned earlier, was passed by Congress and signed into law by President Obama. Just a few of the many provisions of the recent healthcare reform legislation includes establishing an individual mandate, creating health insurance exchanging, providing tax credit to businesses that provide health insurance, expanding Medicaid, and providing discounts on brand name drugs and free preventing services. But like I mentioned earlier, all of this is changing as of right now, and I don't think anybody can say where Trump is going with it, but I guess soon we'll find out. So, understanding problems of illness in healthcare. Although human health has probably improved more over the past half century than over the previous 3 millennia, the gap in health between rich and poor remains wide, and the very poor suffer appallingly. Poverty may be the most powerful social factor affecting health, but other social factors that affect health include globalization, increased longevity, family structure, gender, education, race, and ethnicity. So, that concludes the PowerPoint. Now let's go into our Blackboard. So this is week 2. These are the learning objectives. These are the assignments. So first you're going to read chapter 2. Under the reading of the chapter 2, you're going to find the recording of this session that's going on right now and the quiz for this recording right under it. This is the chapter 2 PowerPoint that we just went over, so if you need to go over it, it's there for you to use. And these two assignments right here are the Cengage assignments. And this is written assignment 1, the coronavirus and race, like I said earlier. You're going to read chapter 2 and then watch the video article linked below to complete this assignment that must be submitted through the Turnitin link directly below on this page, which is right here. So there have been reports that African American and blacks are disproportionately affected by the coronavirus. Read the following article and watch the video attached to it. Here's the link. And then for this assignment, answer the following. Write a 5-sentence summary of the video offering insight as to why African Americans and blacks are disproportionately affected by the virus. And then give 3 examples why one would say African Americans or blacks are disproportionately affected by the coronavirus. You're going to cite the video and your textbook in APA format. So for those of you who are not aware what APA format is, APA format, Purdue, this right here is one of the best websites, and it'll teach you how to do it. So if you look here, APA format style guide, in text citations, authors to authors, how to do a reference. So this basically shows you how to do it. So let's do in-text citations. So let's say let me see if it's here. Let's see, long quotations, short quotations. That's not it. So we'll go here, unknown author, organization as an author, So electronic sources. If possible, cite an electronic document the same as any other document by using the author, date, and style. So you would find the author or the organization that, let's see, is linked to that. So we'll go here, pause that. And these are the 3 people that you would cite. So if you're citing something that there's 3 people in this interview, right? Here are the 3 names. Let's see. There are 2 people being interviewed and the person interviewing. If you're going to quote what Dr. Sherelle Barber said, you'll put Barber, 2020 because it's about coronavirus. So it just came out, 2020. If you're going to quote Nicole Hannah Jones, you'll put Jones, 2020. And if you're going to quote the person interviewing, you can have a choice. You can either put her name, her last name, or you could actually put Al Jazeera comma 2020. So that's the way you would do in text if you were going to quote this video for the homework. So back to here. Also, if you go into ASA College website and go to the library information, all through there that could help you. I could also access information on how to correctly cite APA format. And then the next assignment is the Tuskegee experiment. You're going to read chapter 2 and watch the YouTube videos linked below to complete this assignment, and it must be turned in here in the Turnitin link. So this is worth 100 points. So use your sociological imagination when answering the questions. Think about the race, education, and socioeconomic status of the study participants and how it played a role. So watch these following 2 videos, and once you're done, you're going to summarize your understanding of the Tuskegee experiment in 5 sentences in your own words. And then you're going to answer, what do you think this group was, why do you think this group was targeted for the experiment? Why do you think it took so long for the experiment to become public? What do we as a society learn? What did we as a society learn about the from the Tuskegee experiment? And again, cite the YouTube video and your textbook APA format. You are getting points for this. You are expected to cite. If you do not cite, you're not going to make these points. You guys need to get in habits to cite your work. So I know that you don't see it now, but the due dates are going to be placed in within the title, just like I did for week 1. Here's here is week 1. And if you see here, I put due May 26th, due May 26th, due May 28th, due May 28th. So you're going to see the due dates on the headings as well. So I'll be posting this, as you guys know that I made an announcement. I'm going to be posting this video on Monday, and I'm going to be opening up the week. And I'm going to attach the lecture quiz right under it. On Tuesday, you have a choice whether you want to work on your assignments if you choose to. By Wednesday, the lecture quiz must be submitted by 11:59 p.m. If you do not complete the lecture quiz, you will be marked absent for the week. So just to be clear, every Wednesday from now on, the lecture quiz is due at 11:59 p.m. So Thursday, we will meet during our regular class at 1 p.m. to discuss the chapter and assignments. And being that you saw this pre-recorded lecture that I'm currently recording, and being that you completed the quiz by Wednesday, our classes on Thursday should only last about an hour to an hour and a half. Okay? Then you're going to work on your assignments on Friday if you choose to. And the due dates for your assignments, like I said, are going to be posted, like I showed you right before. Week 1 is currently open. There are assignments that need to be due. And that's about it as far as the assignments. So this ends our pre-recorded lecture for the day. I will see you guys on Thursday.